Hey everybody, welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor, brought to you by his websites, metabolicdoc.com and anabolicdoc.com. Also his YouTube channel, Anabolic Doc. And at those websites, you can pick up a copy of America on Steroids, It's Time to Heal, also available on Amazon.com. Doc, what a video you did this week on your channel, Anabolic Doc. Anadrol, A-bombs. Oh my goodness. Look how happy I got.
You got very happy, I saw.
Everybody loves Anadrol. Everybody. You know, at least for a while. So.
Wow. Why?
Well, I'll tell you, because if you're using injectables, if you're starting off a cycle with something like Cypionate or Nanate, Deca, Equipoise, it's going to take at least a week, if not 2 weeks, before if you feel a damn thing, you still look and feel natural. It sucks.
Natty.
So, natty, yeah. Nobody wants to feel that way or look that way. So, sorry, natties. I used to be one for many years, don't worry. So, Anadrol, you know, people like to kickstart cycles off with orals because they want to start a cycle off looking better, feeling better, getting stronger, putting weight on the scale. And boy, oh boy, nothing does it quite like the A-bombs, Anadrol. I should note, because the younger people are thinking A-bomb. What's an A-bomb? Okay, we used to have this Cold War thing with Russia, and we were afraid of the atomic bomb being dropped on us. There were these things, so look it up. That's what an A-bomb is.
A-bomb.
Yeah, Doc, it was a very enlightening video you did. You know, I knew they were dangerous. I try to ignore all that stuff, of course, live in denial. But it is the most powerful oral agent you can possibly take. You confirm that scientifically. And I believe it is also the most dangerous. Am I right?
Yeah, I think it's that and check drops. I mean, there's, you know, so yeah, maybe I'll do that next. I mean, but that's esoteric stuff. But yeah, Anadrol, super.
I don't know any. I've never seen a check drop in my life.
Yeah, I've never seen them, but I've heard stories. But yeah, Anadrol is powerful, old school oral drug.
Yeah, you say old school. You know, you always go into the history of these drugs, which is fascinating because, you know, most people have no idea. So that was first developed by Syntex in 1959.
Unbelievable.
It's crazy to think that technology with certain things, like think about what telephones were like in 1959. Think about televisions. Think about cars compared to now, 2019. But we're still using pretty much the same steroid technology. What's that? Almost 60 years later. Wow.
It's not, and then we have SARMs that really are just not ready for prime time at all yet.
And, you know, I've used people. I don't think there's anyone who's used SARMs who would say they're dramatically better than steroids in any way.
No way.
They're not really an improvement. You know, theoretically, it was supposed to be like no side effects, but that's not turning out to be the case, is it? So.
No, it goes to show, and I think it's not that there's not lack of money, although maybe it is inherently that these are all generic now. But the market for muscle building for just older people is just got to be a trillion dollar business. But it shows you that it's so difficult. There's no way to really reproduce and to do better than the old school steroids, but they're obviously toxic as hell.
Yeah. Now they were developed, they've had medical applications, and it was a specific type of anemia. You said that they were, especially people going through chemotherapy, the type of anemia that they develop, Anadrol, or, you know, the oxymethylone, the chemical name for it, was found to be the most effective at treating that.
So here's the thing. And I learned so much on doing these research too. You know, I read it over and over. Every time you read something, you go back and do research. You know, you just learn. You put something else together you didn't know before. So, or it just drives it home. So, anabolic androgenic steroids, for one reason why they increase the red blood cells dramatically, is that they all stimulate EPO. They eat EPO from the kidneys, and then that increased EPO goes into stimulate the stem cells in the bone marrow, then you increase red blood cells. So this drug is one of the most powerful agents, more powerful than testosterone or DECA, on increasing red blood cell. It's called erythropoiesis.
Yeah, you said it's 5 times.
5 times.
It increases red blood cell count 5 times better than test or than anything else. Is it? I wasn't quite clear.
5 times greater than what just a standard person is existing, you know, a baseline, just, you know, if it's a man, his normal, you know, endogenous testosterone 5 times.
Yeah. So if you have anemia, that's awesome. But
So if you're taking it's called cytotoxic anemia, where the chemotherapy is obviously taking out the cancer, but it's also going past it and destroying the stem cells in your bone marrow, and your pancytopenic, which means your white blood cells are down, your red blood cells are down, and your platelets are down. And I've seen this. I mean, I work in hospitals for almost 20 years before I became the full-time anabolic doc as of a couple of years ago. And we see cancer patients on the cancer wards. We see them cytotoxic. Now we have Neupogen. We have EPO. You see, we have these new drugs that these hematology oncology experts use. When I'm on the service as an internist with my people, I've seen these drugs they're using. And in the old day, before all these different regimens to directly stimulate the stem cells directly by the biologic agents, we had to use Anadrol and decadrobolin.
Yeah. Well, they worked.
It worked. It does work. It does work. And, you know, I really have to go into the history panels and find some doctors or someone that really used it regularly, because it was used from the 60s into the 80s. It was used for medical purposes because that's what it was actually indicated for. So it would be great to put together some real true stories of, like, you know, in this cancer ward in Los Angeles, they used Anadrol, and here was the regimen. They used, you know, cc or 2 of Deca, and they used Anadrol. I mean, was there a little bench press machine down at the end of the hall?
Now, it was also used, or is it still used, for AIDS patients?
So let me tell you about that. As I was doing the research on that, you know, I spend hours doing the research so no one smashes me. I want to get it right. And I was finding all the research in the 90s that it was used and was doing so. And we know that, you know, AIDS patients, even currently, they can get testosterone, decadrobolin, and growth hormone, right? All the guys who buy I always feel bad, like, you're buying growth hormone kits. This is some poor AIDS guy suffering somewhere where you got his.
Most of the guys I know who are getting legit growth hormone, it's being sold to them from an AIDS.
I mean, I just feel bad for the AIDS guy somewhere. Like,
don't they need it?
I mean, that's what I mean. So it's always, hey, I know it's real. Why? Well, the guy I got it from another guy who got it from another guy who got it from the AIDS guy. I mean, really? So anyway, so with that said, the Anadrol studies in the 1990s, there was 2 or 3 big studies, 1, 2, and 3 Anadrol A-bombs a day.
Yeah.
And look, I mean, it showed, if you read, I mean, of course I'm reading, I'm always pressed for time, so I'm reading, and this is technical reading, and I'm reading it, and I'm reading the description data, and I'm like, wow, they increased the muscles, they felt better. Now, there was a point where they didn't feel well, but then I was trying to find, did their liver enzymes go up, or did they not? They obviously went up to some degree, they had to, but did they have hepatotoxicity? Ron, I was trying so hard to find that controversial twist where I just couldn't put it together. So it seemed like sometime in the late 2000s, it just kind of went away. And there's people with AIDS still around, although antiretroviral therapy is widely improved to the point where, you know, Magic Johnson, he's cured. He's kind of technically cured of HIV, right? Yeah. So when people have HIV, they don't have AIDS yet, right? AIDS is the end wasting syndrome where it's called cachexia, and they're just wasted. It's a wasting. So that's when they were using this. And at that point of life, you're going to use everything you can to make someone feel better. And so this worked. I don't know how toxic it was, but all the stuff, and then please, anyone out there that really knows scientists and knows more about this, someone in the gay community or something, can you please, like, tell us, like, well, let's have the person on the show, because are there real scientists out there somewhere? Like,
you put these calls out all the time, and yet people still slam you in the comments like, you don't know this or that, but you admit freely you don't know everything.
I don't know
3 or
anything.
4 hours of research isn't going to, we
No,
need someone that's made a career out of this, who's
I,
really done some research.
I sit in my office every day, and I'm obviously still getting 1 or 2 new patients a day. I'm pulling the hair out of the head, still some hair left. And I'm having a great time. I mean, the guys, another one joined a few hours ago. One joined in the morning, and that's for the 1 hour consult.
Yeah.
That's for the whole world. So that's going to be a guy I'm going to probably talk to in my office or on Skype or Zoom in the next 2 weeks. And then every day I see a new patient come in from anywhere around the world to see me after I've done the consult. It is, you guys, Ron. It's just freakish, man. And what I'm seeing is, from guys who just, they need to be told, look, don't do it anymore. Or let's wean you off, or or they have questions to, guys that I'm seeing that the kidney disease stuff. I mean, again,
Yeah. So
FSG. I'm just trying to. I know I digressed on that.
I got to reel you back in, Doc. We're talking about Anadrol. So, so Anadrol. I mean, guys love it because, like I said, it does have the, obviously it's very hepatotoxic. It's rough on your liver, but you get this water bloat, which, most people would be upset about that, but certain strange part of the population loves the water bloat.
Strong.
If you're an off-season bodybuilder and, you haven't gotten to that point yet where you realize being big and bloated probably isn't the best thing. It took me a while to figure that out.
Chicks don't dig that.
You step on the scale every day more. You're bigger. You're heavier. Even though your face is like a pumpkin.
Oh.
You're red as a beet.
Oh.
And yeah, you're getting stronger because you got all that cushioning in the joints now. And like you said, it's a huge off-season drug. And I want to correct you because you probably didn't know this. I didn't know this until a few years ago. I was talking to someone who had worked with a well-known coach in the industry. Obviously, I'm not going to name him. Because I don't even know if it's true, because people talk so much shit. Supposedly, this guy would have his clients on 6 to 8 Anadrol 50s a day.
Come on.
For about the last month leading up to a show, and the rationale was to stay full, to stay big and full while they were in that catabolic state with all the low carbs and all the cardio, and then they would just cut it. I don't know how far out, a week, maybe even sooner, because the water retention. Wow. It's a short-acting drug. It's got a short half-life. You said a 16-hour half-life. So no matter how much of it you take, within a few days, it's going to all be out of your system.
True. Wow. Are you kidding? Wow.
So do the math on that. That's 8 times 5 is 400? No, wait a minute. More than that, right? I'm so bad. Yeah, 400 milligrams a day of that. Now, on the comments, we're not saying this is true because people can say anything online. Anything. They could say the sky is purple. Scott Mendelson, someone said.
Oh.
Okay, this is probably completely spurious, complete fiction. It said Scott Mendelson did 20 a day and he bench pressed over 1,000. I don't believe anybody, even someone who's, like a 300-pound plus guy?
Oh my God.
I don't believe he would use 1,000 milligrams of an oral steroid every day.
There's no way he did. I mean, I don't know Scott personally, but I'm a power lifter, so I'm from his world. Yeah. And if anyone knows anything, he's one of the first and only men in the world, the very limited, maybe half a dozen in the world that have legitimately raw benched 700 plus. And raw, like just with a t-shirt on.
That's no crazy equipment.
I mean, and Scott Mendelson is a genetic masterpiece. He's also a very bright. I don't know if I like his personality always so much, the way he's cocky and all this, but he's probably a really nice guy, I heard. But he's a genetic freak of the world. The guy's repeatedly, I think he's still super strong, and he's not young, but I hope he's okay. Right. But there's no way he's not. The guys, look, they use their agents, their supplements. We're not going to go into it. I want to be very careful not to disparage any of my people, and he's not a patient of mine, but he didn't do. There's no way anyone would ever. You can't even live. That's not sustainable with life.
I mean, I know you're not going to. Maybe this is one for Dr. T, because he'll take these these reckless type of questions. He's like, oh well, if they're going to do it, I'll answer it. But these are 50 milligrams in just one tablet. I mean, I wouldn't be personally comfortable. I'm not afraid of drugs, and but even at my most reckless, I don't think I ever would have used more than like 75 milligrams of an oral agent, be it D-ball, Anadrol a day. I would in my heart of hearts, I think that's enough. That's plenty. I can't see where 100 or 200 or 400 would give you a better result. And the sad thing is, some people I've talked to that have done those extreme amounts are the ones that were afraid of needles. So they just want to do pills. I'm just going to do some Anadrol, bro, like 4 a day.
Oh, I know.
Good luck
So
with that.
remember the stories I've seen of the liver damage are all Anadrol or D-bol or Turinabol, out in the other countries, and they just live on it for months upon months, even years. It is true, but little, 1 or 2 a day. They go on and off. Let me ask you a question. What in the community that what is the typical use of Anadrol, like dose per day, max?
1 to 2.
Yeah.
1 to 2. I've heard of higher, but that's rare cases. These are like, I've talked to some pros who did that for a limited time, like I said, to stay full or whatever.
But that's on top of test and other steroids.
Yeah, that's a whole stack. But to kickstart a cycle generally, so you start feeling something, because these injectables do take a while to start getting into your system and seeing any result. They will start with 1 or 2 a day, and usually they'll limit it to no more than 30 days.
Wow.
That was always my thing. 30 days is enough. I'm not going to take anything oral for more than 30 days in a row, because I believe, with no evidence to back it up other than bro science, that's when you're starting to get into dangerous territory for the liver. I mean, just so people know, because there are people out there watching this right now who are using Anadrol, what are some signs to look for? Would you see, by the time you see like jaundice in your eyes, is it too late? Or are you going to
Here's the deal. So here's what I can tell you from what I've seen over 10 years and thousands of patients coming in, like either directly on oral agents like D-bol or Anadrol, Superdrol, or just soon. Usually guys come in after they come off, right? They come off, doc, let's get some blood work done. So I've only seen a couple of cases. I'm just being honest. This is not giving a blessing. It shows you how strong constitutionally just young, healthy people are that are doing these drugs, because they're young and they're healthy, and if you're unhealthy and you're sick, you're not going to be doing this, right? Because you're trying to get healthy and you're a cancer patient or some poor but these are young, healthy. That's the whole paradox. You're young and you're healthy. You have a beautiful, healthy body, and you're doing all this. Okay, so I had to digress. So guys come in, they're on Anadrol, like the 1 to 2. Actually, I've seen powerlifters will do like 3 a day, 4. And they may do 3 or 4 a day on lifting days, 2 days a week, and then 1 or 2 on the other days. But I'm not.
I'm going to interrupt just brief. Hopefully we'll get back on track. But would you say that they're a dose-dependent thing? Like, would you be as alarmed to see a 320-pound man powerlifter using 3 a day as you would, say, a 210-pound bodybuilder?
That's a good point. And depending on the pharmacologic distribution, the pharmacokinetics, it should be different, because it's like any other drug. It's a milligram per kilogram body weight dynamic. So that plays a role. But typically you see the same doses, and the guys are from 200 to 300 or so. So the guys come into me, they're on 1 or 2 Anadrol, but it's always with test and tren or D or DECA, combinations. And I've only seen a few guys with being jaundiced, because they pop into me after coming out of the hospital and they're still jaundiced, but the doctors, they sent them home because they were in the hospital for a night or something, and they were like, okay, you're jaundiced, the levels are coming down, you're otherwise stable, go home, see your doctor, and they come right to see me. I got cool cases. And then I watch them. I, of course, always work with a hepatologist and a GI expert. Or I always get immediately, they usually have a referral to someone, and I either keep it or I get my own. I have my own experts that I work with depending on what part of the country I'm working. And then I just watch them. And in every case, except for a very limited few, and these men, if they're watching, they're around Connecticut, they end up with very bad, liver disease. But everyone, the transaminases and the bilirubin levels, they go back to normal.
Yeah, in most cases, I've always heard the liver is the most regenerative organ.
But that's why, in the end, people can do this for so long. And I'm not giving any goddamn blessing. I'm just saying people are so resilient. How much of this? Why would you want to do that to your body? Like you've done stuff. And I'm not. I love all you guys. It's like people do it. I did a little bit too back in the day. But then I'm kind of wondering what's it going to do later is it going to, there's no free lunch. Every action is an equals opposite reaction. Later, mainly on the cardiac and the kidney system, I see you're just going to shear off. If you have this much of a buffer, you want to hold that buffer because you're going to get old, and you want the buffer just because you're going to get old. So you're going to come into threshold of a heart attack or kidney disease earlier, and I see it all day long now. So, and now oral agents, do they play a role in that? The liver is a monster, so durable. Don't mess around. The liver, I'm an internist, I could say it. The liver is a monster, super durable. The kidney and the heart are very fragile. The kidney and the heart do not have that durability to withstand the abuse from anabolic steroids. And of course, it's all man per man, depending on the man's medical history, other steroids. Age is always the worst. You just can't do the stuff in your 50s. And people who are listening know, my patients, that wish it was true, but it's not. Some of the smartest guys in the world are realizing under my care, we got to shrink down. We got to protect the heart and the kidney. That's what I do with doctors all over the world. And, but we love to do another cycle. We love to do, some trying or more tests and D-ball and try to bench big and be big. But, the reality is, can't do it.
No free lunch. So the one thing that's the scariest thing I've ever heard as far as a bad effect of using Anadrol is these blood-filled cysts in the liver.
Yeah.
And are they specifically associated, or at least much more so, with Anadrol 50?
So pileosis hepatis. So here's how, let me explain this to you, and it's kind of piggybacking the question before. So when you do oral agents and they're 17 alpha alkylated, that chemical structural change that makes an anabolic steroid the ability to stay in the circulation for so long, it runs through it literally goes through the circulation, and it goes through your liver every hour, 8 times or whatever it is, based on the circulation of the body. And when it runs through, when that area in that blood, those molecules run through, which they're constantly running through when it's in your system, based on the half-life and the kinetics of how much you're taking, and other drugs you're taking with it, it's gonna stress those hepatocytes, and those hepatocytes are there to clean. They're stressing and straining them, and they will break, they will strain, and that's when you see the elevated transaminases, ALT and AST. I see it every day. We see it every day. And then even like a little bit of oral Winstrol, oral Anavar, oral D-ball and Anadrol, you'll see those go up. And then, but the patient will say, I feel fine, or I'm not jaundiced, I'm not yellow, because your bilirubin levels are under 2, under 3, and you're fine. So in the beginning, the oral agent will strain the transaminases, the hepatocyte. Everyone's going to have some elevation of the transaminases, those AST and ALT. And then this is for Dr. T. And then you stay on it long enough, more dose. Maybe you have a genetic deficiency in the enzyme of your liver. This is hepatology. And you push over the edge, and you start to get cholestatic changes. That means that you're starting to break down the hepatocyte, where it's not able, it's just choking, it's getting beyond strain, and now you're breaking down the functional ability, you're impairing the cellular function of the hepatocyte, the liver cell. That's the functional liver hepatocyte. And then, and then you start to get increase in alk phos and bilirubin. So that's jaundice. So then again, that's the next level. And again, I've seen it. I've seen every day transaminase elevations. They go up, stop the agent, they go right back down within a few days, not to mention a week or two. And then people go on and off. And then the liver has a huge threshold where it takes it for years. People who drink. So the body's over-designed. Now, the next level after the cholestatic changes is the next level is of damage and destruction on the liver cell from the oral steroid agent chronically and with the high toxic dose is you start to get damage and internal bleeding into the functional liver cell regions, and they start to bleed out and cause these liver-filled cysts. And that's pileosis hepatis, and I'm done. The next stage, and I have to know everything. I've studied this, so I'm very interested in it. I'm not a board certified hepatologist. Even GI guys aren't. Those are special types, internal medicine, GI, hepatology. And those are experts that deal with, chronic hepatitis C, hereditary hemochromatosis, and, diseases of the, and those guys, when I send them steroid users, they're on top of it because they really, and sometimes they have to biopsy. I've seen many biopsies of the liver. So they have to biopsy the liver carefully to determine how damaged it is and if it's going to come back pathologically damaged. This is what I do. This is I love what I do. So when you get past a point of damage, you get those blood-filled cysts. Now, beyond that, I've never seen it in my office. I've seen them after they've been in the hospitals all around the world, and they've had parts of they let it rest, conservative treatment. IV fluid, weeks in the hospital, they control everything else, then you go home, stay off the agent, and then they see if it, and most times, I swear, it comes back. But you can take out you can remove parts of your liver. I mean, they have liver transplant, so the liver is a whole crazy thing. So, but there are areas where they can conform and transform into malignant and hepatomas. And that's that scary thing that liver cancer can happen from steroids. You know what? I'm not going to say I haven't seen it because I've seen probably 2 or 3 cases come to me because I'm the Anabolic Doc and they were late stage. They died. Wow. But did they have, in addition to that, do they have hepatocellular cirrhosis carcinoma, it's called, from hepatitis C, or do they have some congenital other issue where they had a medical issue that with the steroid they end up getting liver cancer? Because people get liver cancer. It's mostly from alcoholism and secondary cirrhosis, hepatitis C.
And say you're a regular drinker and you're using Anadrol. Yeah, probably a double whammy, I'm thinking.
And if you have hepatitis B or chronic hepatitis C, which is more common from drug use, maybe a tattoo or blood transfusions in the 60s or 70s, which I've seen. And that's why we have a group, chat to. I mean, it's just, and people abroad, people from other countries, they have hepatitis C. Commonly in Asia, hepatitis B, and because they don't have the blood bank. God bless America. We spend money on our blood bank. You get a blood transfusion outside of America, good luck.
Yeah, no thanks. So final question, doctor. Do you think, here's my theory, here's where I test my theories out on you. Do you think there's anything a unique property of Anadrol that makes it more hepatotoxic than other oral steroids like Anabol? Or do you think the issue is that because it typically does come in these large strength tablets of 50 milligrams, that people are more prone to abuse it and take higher doses?
Both. But oxymethylone, right, which is the drug, so it's probably, this is for a hepatology doc. Is there a hepatologist in the audience? So please, or a bro science guy that can find something on it. Yeah. So oxymethylone is the reason why it becomes so strong is also on the same edge of why it's so toxic. It's just the paradox of life. It's so powerful. There's equal and opposite. It's so powerful. There's an equal and opposite powerful side effect that's adverse. And the liver, it's very hepatotoxic. So it definitely is more toxic than Dianabol. I mean, but then again, you could how many Dianabols equal 1 Anadrol? I mean, so dose dependent, but it's got to be some liver. The toxicities are always like, if you look at acetaminophen toxicities, I remember I've been in the ER for years and we had to deal with people that are overdosing and trying to commit suicide with Tylenol. And we give them anecdotes because they really go into this. It's an antioxidant scenario. They just chew up all the oxidant abilities of your liver, and the liver goes into this chronic toxic state. And it's all because these experts know how to back all this off with the antioxidant medicines we directly give IV and orally. And I remember seeing it, in the ER. These are toxicology experts. So it's a question for toxicology guys, but there's something inherent to the molecule that's so powerful anabolically that it's just so powerful and destructive to the liver.
Well, there you have it, people. It's the most powerful oral steroid you can possibly use, but there is a heavy toll to pay, people. So I had to throw that out there in the scary voice.
You did.
This has been a short one. Doc's got another patient coming up. He's an actual doctor. He sees patients all the time. He's doing this of his own generosity and helping us all out. So
Love it.
thank you so much, Doctor. Go to his channel, Anabolic Doc on YouTube. He's got a much more informative video about Anadrol 50 with a table of contents at the beginning with the times and everything. It's perfect. So go check that out. Thanks for watching this week's Ask the Anabolic Doc. And again, check out his websites, metabolicdoc.com, anabolicdoc.com. Thank you for watching.